UNICEF is closely monitoring the situation on the ground. Can you describe how the floods had an impact specifically on children?
The impact is huge. It's covered 4 provinces. This is one of the biggest disasters Pakistan has ever seen, and children and women are always most heavily affected in these types of scenarios. About 33 million affected. The need is great. Whether it's around water, sanitation, health, education, protection, all of the areas we work in, we need to expand our coverage, our operations to reach these kids. There's still a lot of kids which haven't even been reached.
According to the UNICEF, what is the number of the affected children, and can you highlight the kind of diseases that they are battling?
Yeah, so there's about 13 million, which we estimate as affected. Immediately in need is probably close to 7 to 8 million. But the biggest issues which we see right now, which are life-threatening, are malaria, diarrhea, dysentery, cholera. These are our big concerns. A lot of that is around the conditions which they're living in. And these people have been isolated and fighting, floodwaters for a number of weeks. That's starting to take a toll on mothers, on babies. And what we're seeing is the condition of the children, whether it's the disease or also the malnutrition, is very dire.
So far, what sort of a foreign aid have you seen that has been received by Pakistan, and do you think it is sufficient?
There's a lot of foreign aid, there's a lot of commitments, a lot of supplies have been flown in from a number of countries, and this has helped the situation. But I think it's very clear that the need is greater. And that includes not just the supplies and support, but the services. And this is one big thing which UNICEF is focused on, are those essential health, nutrition, and wash services.
What is UNICEF doing on the ground to support the children of floods?
So we're in 50 districts responding. Most of those districts are part of the 81 calamity hit districts. And we're there with a full set of interventions. Our first focus is on survival, and it's our biggest concern. And this comes in with a very strong package of water, sanitation, nutrition, and health. And one thing which we absolutely must do is not just focus on the children, but the mothers and the caretakers. When we look at malnutrition, we see it most acute in the young ages. This is when babies should be breastfeeding, and it's been difficult to do, but this is the best thing that can be done for children.
The infrastructure was greatly damaged, no access to remote areas. So what sort of difficulties have you faced during this time?
Well, I was in Balochistan, and large trucks still aren't able to reach into some of the most flood-affected districts. We did pre-position some of our supplies, understanding that the rains would continue, and that has helped us to speed up our response. But the biggest challenge is the scale. That no one agency, even collectively, right now has the capacity to meet all the needs. And this is what we have to acknowledge, but not accept. And this is where we need additional support. We need to work together, and we need to make sure that these people are provided the services which they need.